Better for Friday. Perfect. All right, so everyone, this is Kayla Woods. She obviously is with Ottawa Bylaw. You saw Roger, whose desk she's commandeered due to technical difficulties, but she has graciously agreed to come today to clear up some of the confusion over the requirements that businesses have regarding screening, proof of vaccination, contact tracing, safety plans, and in general, the provincial legislation. And I don't know, maybe Ottawa Public Health sort of interpretation of and how they're abiding by the provincial legislation. So I know on many calls for many weeks now, we've talked at great length about all of those things. We've shared personal stories about having gone as patrons to the different types of businesses that are definitely not doing everything they're supposed to be doing. Of course, not out of, trying to not follow the rules, but simply I think that they just don't understand what exactly they're supposed to be doing. So we've tried to share that every week in our newsletter, but it's definitely not getting to as many people as it needs to. So I will turn that over to you, Kayla. I know Crystal provided you with a list of sort of questions that we've had in the past. And then if you wanted to add anything to that, and then we'll go to, a Q&A after Kayla's done speaking. So you can either use the raise hand button and I'll call on you, or you can put something in the chat and I'll flag that to Kayla. Go ahead.
Perfect. So hello, everyone. Thank you for having us here today. As Andrea said, my name is Kayla Woods, and I'm the Issues Management Specialist with Bylaw and Regulatory Services. Roger was supposed to be joining us today, but I have taken over his computer, but he is around, so we can get him in if there are any questions for him as well. So we're here today to hopefully clarify some of the requirements for businesses under the provincial regulations for step 3. Before we get into the questions, I thought I would just provide you guys with a brief overview of the regulations based on the questions that we have received. So as you're all aware, the province has mandated proof of vaccination in certain settings and subsequently lifted capacity limits and physical distancing requirements in those settings where proof of vaccination is required. Safety plans, the use of masks indoors unless exempt, and other safety precautions still apply. Eligible businesses, meaning businesses or facilities specified in the regulation, may elect to opt in to proof of vaccination each day the business is open, and it is in effect for the duration of the day on which they have opted in. During this time, the business is not required to limit the number of members of the public to the number that can maintain a 2-meter distance. And when opting in, the businesses must post signs that inform patrons that proof of vaccination is required at all entrances. This will not apply to settings where people receive medical care, food from grocery stores, and medical supplies. Both proof of vaccination as well as identification must be verified at the point of entry. This can be government issued ID or any documentation issued by an institution or public body, as long as it shows the patron's name and date of birth, and that matches the information on the proof of vaccination. Photo identification is not required. Businesses may verify proof of vaccination either by using the QR code system or by visually verifying vaccine receipts or proof of exemption. Both methods of verification are acceptable, and regardless of the method of verification, the business and organization must confirm that the patron's name and date of birth on their ID matches their proof of vaccination or exemption letter. We also got some questions to clarify the use of PPE. So with respect to PPE, under the regulation, a person is required to wear appropriate personal protective equipment that provides protection of the person's eyes, nose, and mouth, such as a mask and face shield or a mask and goggles, when providing services if they are required to come within 2 meters of another individual who is not wearing a mask and is not separated by plexiglass or another impermeable barrier. This applies to staff at a restaurant serving food or beverages when a patron is eating or drinking and not wearing a mask, or in personal care settings where the removal of the mask is required in order to receive the service, such as facials, beard trimming, etc. We also got some questions asking to clarify active screening versus passive screening. So active screening is using the provincial screening questions. There are two sets. There's a separate one for customer screening and a separate one for worker screening. And I can send out the links for those questions if you'd like. And passive screening can just simply be a sign with clear instructions at all entrances that tell people how to screen themselves and not to enter if they have symptoms. Where active screening is not indicated in the regulation, passive screening is required. However, people who work for the business or organization must be actively screened before entering the premises. With respect to contact tracing, we have received questions regarding obtaining information from all individuals versus one person per table, for example, in a restaurant setting. To clarify, the regulation indicates that where contact tracing is required, it must be obtained from every member of the public. Therefore, the name and contact information of each individual at the table would need to be collected. So the province announced on November 10th that it was pausing the lifting of capacity limits in the remaining settings where proof of vaccination is required, such as food or drink establishments with dance facilities. Therefore, food or drink establishments with dance facilities are still limited to the 25% capacity indoors or 75% capacity outdoors, and distancing requirements continue to apply in these types of establishments. Bylaw and Regulatory Services analyze call data and focus enforcement efforts in areas where we are receiving complaints. Overall, we are seeing that compliance in Ottawa is high, with the majority of businesses ensuring proper requirements and guidelines are being followed. We would encourage everyone to keep doing what you're doing, checking proof of vaccination where applicable, masking, and distancing where applicable. We're focusing efforts towards industries that we are primarily seeing as non-compliant with the provincial regulations, such as some quick service fast food industries and a select number of gyms and fitness establishments. Fines can range from $750 to $100,000 for individuals, or up to $10 million for corporations. Charges can be issued for each violation found. For example, if an establishment does not verify proof of vaccination, contact trace, or actively screen where required, they could face multiple charges. We acknowledge it can be very confusing and hard to keep up with the regulations changing frequently. And we want you to know that we're here to support you. And any way we can do that, just let us know. We're happy to help clarify, answer questions, just reach out. Thank you.
Excellent. Thanks so much. I actually have a question just with regard to what you said about the contact tracing. Sorry, and I might have missed it, but did you say that each person at the table has to provide contact tracing? So it's no longer, okay, I'm going with 5 friends and I provide my name and that's it, every single person?
It's every member of the public, yeah.
Okay, because that's definitely not being done. And again, I truly believe that most, 99% of businesses just don't realize they're supposed to be doing that.
Absolutely.
Yeah, and so when you said multiple infractions, did you mean multiple? So if I'm a gym and I'm only asking for vaccination certification and I'm not contact tracing and I'm just making an example. I mean, most gyms you have to sign up anyway, but let's just say they're not. And then they're not actively screening. They have a poster, let's say, at the door. So they could get an infraction for not actively screening and not contact tracing. So they would get 2 different fines, but it's not per client. It's for or is it?
It's for the violation of not checking.
Okay.
So if they weren't screening and contact tracing or asking for proof of vaccination, they could face 3 charges because they're separate.
All right.
Again, it's based on investigation and obviously whether or not it's warranted, but it's a possibility, yes.
And I'm assuming that when you receive a complaint, it's probably, and you're responding to it, it's probably because you've received multiple complaints about the same place, or, not
Yeah,
just.
yeah,
Yeah,
exactly.
okay. If anyone else has a question, again, just raise your hand or just unmute yourself or put something in the chat. Charmian, go ahead.
Oh, good morning. Thank you so much for coming, Kayla.
My pleasure.
Hi. I'm getting ready for work. I never show my face. Um,
That's okay.
so we have a massage and physio clinic, and yesterday's power outage kind of highlighted something that I don't see a policy for. So
Okay.
just as we were about to cancel patients, the power came back on, but we just logically would cancel patients because without power, we have no ventilation. So we were assuming that without ventilation, we can't be open. Would that be a correct assumption? Or maybe you can get back to us with that answer.
I don't, off the top of my head, I can go into I don't believe there's anything in the regulation with ventilation. I think that's more of a public health standpoint. I mean, obviously, I
Right.
think it would be ideal to have proper ventilation. But let me take a deeper dive through the regs. I don't think
there's anything there.
on that. Yeah, so that
Yeah.
might be an OPH question, but
Yeah.
If you want, I could get you in touch with someone if you wanted to send me your contact information.
Okay.
And there is an OPH call similar to this set up through the Ottawa Coalition of BIAs. Are you attending that, Kayla?
When is that? I haven't been invited as of yet.
Okay. Yeah, well, it is OPH focused, so with
Yeah.
that, they might actually speak to something like that, Charmian.
Okay.
If you'd like.
Okay, thank you.
Yeah, so Kayla, I don't know if you're interested in just sitting in on that as well. I can send you the link for the call on Friday. Or I don't mind also asking that question if you're not able to attend, Charmian, on Friday. What time?
Thank you so much.
Remember what time exactly it is that I have it on Friday? Is it 10? 10, Crystal? Or okay, yeah, 10 a.m. on Friday. Yes. So, and it's over Zoom. Maybe I'll post that a little later in the chat, actually, the link to that, in case anyone else is interested as well. We did, Kayla, get a question from somebody that wasn't able to attend today. And they specifically, they're working in a hair salon. I know Crystal had asked previously about velvet chairs at a spa. So this is kind of along those lines. And they're asking if they're allowed to serve clients coffee in their hair salon, and also magazines, things that are like multi-touch surfaces, like that would be shared with multiple clients. So he's just wanting clarification as to whether or not they can offer coffee or other beverages, and if they can put out magazines in the waiting area, or while they're waiting for their hair dye, I guess, to set or whatever, if they can offer a magazine.
Yeah, so there's actually nothing in the regulation that would prevent magazines or anything. It would just, you'd want to keep in mind cleaning and disinfecting. It may be harder to do so with paper and magazines, but there's nothing that would prevent you from doing that. So are you allowed? Yes. From a health perspective, I can't really say whether that's recommended or not. Again, I think that's more of an OPH geared question, but there would be nothing preventing that. And again, with coffee or tea or anything like that, there's nothing in the regulation that would prevent that. Just keeping in mind, obviously people would need to take off their mask to eat or drink. So they'd need to make sure that goes back on immediately after they take a sip.
And that would that require the worker then to wear the eye gear as well as a mask then, if the client's taking the mask off, like similar to a restaurant situation? Or?
Yeah, if they're coming within 2 meters of a person who's not wearing a mask, then they'd have to wear the face protection, or the eye protection, sorry. So again, I think that would be a business decision. And you'd want to be mindful that the mask has to go back on when you're done taking your sip.
Yeah. Okay. Perfect. Okay. Anyone else have any specific questions, industry related or general? I see Bob. Go ahead, Bob.
I question, we had a surprise inspection from provincial inspector in one of our stores just a couple of days ago. And he went through and he noted that we had proper plexiglass in place and that we were disinfecting counters and stuff like that properly. And so everything was okay. I hear on the radio this morning, this Dr. Peter Uni says that those two things are no longer needed and are actually unhelpful. He didn't actually say they were bad, but he did say they were served no purpose, basically. Are they still on your checklist of things that are required?
So cleaning and disinfecting is still in the regulations, and the expectation is to maintain a sanitary condition.
Yeah.
So, I mean, it's
And the
not really
plexiglass,
defined, but what establishment are you? Like, what type of setting are you?
we're a small chain of retail stores.
Retail.
Yeah, non-essential retail store.
Plexiglass. Again, it's not a requirement, but
It's not?
for retail cash, no. Let me just go back and double check that before I.
Yeah, because I would assume that the employee and the customers would all be masked. So
They have to wear a mask. Yeah, that's
Yeah.
definitely. But the plexiglass, like you're speaking about at the cash, right?
Yeah.
Yeah. It's not required, but obviously I think it would be recommended by public health. Yeah, it's no longer a requirement. I don't think it's bad to have. But yeah, it's not in the regulation.
It was at one time, wasn't it?
I believe it was, yeah. And it is not there anymore.
Okay, because this
Okay.
provincial inspector kind of implied that it was required. He ticked a box saying it was there.
I'm not too sure. Maybe I can get Roger in on that. I don't know if, one second.
Yeah. Okay, I'm surprised by your answer, but I was more making a comment about public officials saying things that are contrary to what's written down, you know?
Yeah, I would suggest that the provincial inspector may have been looking at it from an employment perspective. So
Yeah, yeah,
where you have two staff members
yeah,
possibly in close contact, right? So the need for eye protection if they're within 2 meters. So if you have a plexiglass separation between the two caches for your two employees, then it would remove the requirement for them to wear eye protection. So he or she may have been looking at it from that perspective. But definitely in the
I don't think so.
in the regulations, there's no requirement for that type of barrier between the customer and the cashier, your employee. There's nothing in the regulations, as long as they're both wearing masks.
And would that be the same though for the employees? As long as the employees are masked at all times, they wouldn't require eye protection. If
If they're within 2 meters of each other, they would require eye protection as well. Yes.
employees though, not, okay,
Correct.
wow. Okay, Charmian is asking in the chat if that same requirement, the plexiglass, is required for healthcare settings. And currently they disinfect the front desk area after each patient. I would assume the answer would be the same or more stringent given the healthcare setting, but go ahead, Kayla, can you see the chat? The question again, Charmian, do you want to specify what?
Yeah, I had keeping up with all this, I remember an announcement that disinfection did not have to be after each and every patient of the front desk area, not of the rooms. Of course, we do that all the time. But disinfection could now be dropped down to twice a day, of the front desk area, the bathroom, that kind of thing. We're still doing it after each patient, but I just wanted to know if there might be any clarification from the ministry on how stringent their disinfection protocols should be for the common areas. Like, we're still wiping down door handles and all this after every single person.
Yeah, I haven't seen anything from the ministry. I'm just checking. Sometimes they update it, sometimes they don't. Again, I think that would be more geared towards Ottawa Public Health. The regulation simply says maintain a clean and sanitary condition. So, I mean, what that means exactly isn't defined. So I think that would be based on OPH guidance. And I'm just trying to see if I can get an updated guidance document from the ministry.
Thank you so much. Yeah, we're gonna stay the course anyway.
Of course. And again, I think what you're doing sounds like it's the right thing to me. I don't think you can clean too much in those types of settings.
Right. Thanks so much.
No problem. I'll take a quick look as well for a guidance document for health settings and see what I can find. And if I find anything, I can send it to you, Andrea. Perfect.
Yeah, perfect. Or Crystal, we're going to be including a summary of the entire call on Friday's email. So if you happen to get it before Friday, and we'll make sure Crystal includes answers to questions that we don't have readily at hand right now. But if you be able to get them by Friday, that would be perfect.
Absolutely. I'll have a look.
Okay. Anyone else have any questions this morning? Go ahead, Crystal.
Yeah, we get a lot of questions about active screening and sort of what that can look like. I know that David has asked me in the chat as well this morning. Does it have to be going through the provincial app or website step by step? So some businesses that are required to do it are having people look at a poster and saying, hey, take a look. Are you good? Check. They're asking them, but they're not necessarily running through every question. Some have like a Google form, like a QR code and a Google form that you go in and they do the contact tracing at the same time. Are those acceptable ways to do it? Sort of what is that line of what is active screening?
I would say as long as those questions are like, you don't have to go through the provincial webpage next. You could have them listed and ask, do you have any of these symptoms? No. Great. Have you been in contact with anyone? Just make it more high level. So long answer, sorry. Yeah. Yes, that would be fine. As long as those questions are being asked in some capacity.
So as long as it's verbally being expressed as something, as opposed to passive screening where you see it on the door, nobody ever asks you when you walk in the grocery store, for example.
Exactly.
Yeah. So as long as they're being asked. I mean, I think at this point, anybody who's coming in sick is doing so knowing that they shouldn't be anyway, but
yeah,
we've all seen and answered these questions so many times, but
of course.
Yeah, absolutely.
I've been living under a rock for 2 years, and
that answers that. And then for contact tracing, again, so the restaurant has to keep them for 30 days, the names and phone numbers. Name and phone number is fine, no additional information.
Yep, that's perfect.
Perfect. And they can do it any sort of way as long as they're ensuring that every patron or customer in those settings that they're keeping your names.
Exactly.
Perfect.
I would assume that has to be logged by date so that they know this group was all here on the same day and possibly contaminated. Okay.
That would help for sure. Yeah.
Excellent. And just to clarify one other thing, you answered it at the beginning, but just to be 100%. So businesses that are required to, that their patrons are required to show proof of vaccine, they are not required to actually scan QR codes if they opt to just visually.
Exactly.
Yeah.
Yeah. It's just a different verification system. They can use whichever they prefer.
Absolutely.
And
Perfect.
with the scanning option, if you do decide, you still have to ask them for identification. the second.
Exactly. And then you still have to match their birthday and their name. Make sure that matches. So
Perfect. And I'm going to ask this question. I know the answer, but sometimes if they hear it from you, who is required, what businesses are required to have safety plans?
so pretty much all of them should have a high level safety plan. And then certain where it's specified in the regulation, they have to have an extra piece. So I can get the section in there for you.
Mhm.
Oh, no. Okay. So all businesses that are open need to have a safety plan available. And for the specified businesses in Schedule 2, they also have to include information as to how the business will prevent gathering and crowds. Ensure Section 3.2, which is physical distancing and face covering in lines, how they'll ensure that at a place or event and mitigate the risks of any interactive activities, exhibits, or games. So it just needs to have those extra pieces, but all of the businesses should have a safety plan available.
Perfect. And one other question that I've just seen asked on social media in the last couple of days with the excitement over children now being eligible for vaccines. Again, I think I'm pretty confident I know the answer, but some people are asking, does that mean that as of today, my 5-year-old has to have proof of vaccine to go to a restaurant?
So at this time, the provincial regulation is still 12 and under. I anticipate that will change, but as of right now, it hasn't. So making an assumption, I would assume they would give a bit of time to make sure they have time to actually be double vaccinated before they put that in the regulation, but that's on a provincial level. So who knows?
Yeah,
what
yeah,
they'll
yeah,
decide to do.
absolutely.
But at this time, it has not changed. It's still 12.
Excellent. And I'm just getting a question in the chat. So this is from Trevor Stewart, and they own a music school, so private lessons, music lessons. If they have weekly returning clients, if we check them once for vaccination, do we have to recheck for vaccination every week?
Yeah, so the regulation does say at the point of entry, but if you have regular members, I mean, the vaccination status isn't going to change. What I would suggest though is to have, a list or something indicating that, even if it's just a check mark and the date and the employee that checked them, in the event that there's a call and bylaw shows up, you want to have something to indicate that you have checked.
Kayla, can I ask then, but are you still required as a patron though to have that with you at
Yes,
each visit?
yes.
And that kind of makes it hard for the business though to police if they're not asking every time, right? Like, so if a bylaw officer was to happen to go in and they realize, okay, this person didn't get asked, this person, and the staff member was to say, well, we checked them on this date, but then Jane Doe doesn't happen to have her ID on her that day, who gets the ticket? Is it the person without or would it be the onus is always on the business, or?
In the regulation, both the patron and the business can
Okay.
be charged. And I think that would depend on what the investigation found. But like I said, that's why you'd want to make sure you had something that showed you checked at some point with a date, as opposed to nothing and then there's no.
Yeah. So realistically, it's probably better to err on the side of caution and just ask every time, because then you're sure that they physically have it with them.
Yeah, may
Kinda
not be
cover
a bad
your-
idea, but
Okay. Now with regard to the 12 and under, and I assume this is the same answer, places that require proof of vaccination may likely, that might change provincially, that age, as more children are able to get vaccinated. So would that also apply to things like public facilities like City of Ottawa arenas and gyms and that sort of thing? Like right now for team sports, I know kids 12 over are required to be vaccinated in order to play on a team sport. But children under 12 are not required to be vaccinated. So I'm assuming that would probably change as well eventually when it.
yeah, I would assume so. Again, I mean, that'll come from the provincial level, but it would make sense. So that's what I would imagine they would do.
Okay. Any other questions for Kayla at this point? No. All right. I will thank you so much for coming and for answering all of our questions. Yeah, there's definitely so much confusion.
Of course.
And I'm sure even for yourselves at bylaw, it's probably confusing as well.
It's hard to keep up even for us. So I definitely appreciate how challenging this is
Yeah,
for business community for sure.
right. And okay, so if we don't have any more questions, we will sort of end it here. Kayla, I will reach out and send you the link if you're interested in joining that OPH call, just to sit in on it on Friday morning at 10. That's being hosted by the Ottawa Coalition of BIAs. So there'll be businesses from across the city at that one. Right. So have a great morning and rest of the week, everyone. And thanks for joining us.
Thank you.
Bye. Thanks, Kayla. Bye. Thanks to Roger as well.